Hello, everyone, and a very warm welcome to Chainet, the agentic commerce podcast exploring how brands are building in an AI world. I'm Rachit and I used to thought that hair loss is just something you have to accept or a problem that you try to solve with a bottle of chemicals. Sometimes it gets solved, sometimes it does not. But what if the answer was actually a wearable device instead of all the chemicals you're putting on your head? Today, we'll be talking to Carlos. He's a cell biologist who spent years studying stem cells at the world famous Max Planck Institute. He didn't just write a paper. He's built a headset called Niostem that aims to wake up dormant hair follicles and grow your hair back. Now, he's gone from being a scientist to being a founder, and he's gone from being a CEO to being a CTO, gone from researching something to actually getting the product in the market and seeing the real world impact of it. So we're going to learn a lot today about why is it so hard for humans to keep, for at least men to keep the hair on their head, and what is the hardships of for someone who's in the research space to become an entrepreneur. So let's welcome Carlos to the stage and let's get going. Hi, Carlos. How are you?
Hi, Rachit. I'm pretty good. How are you?
I'm doing well. Thank you so much for joining in. So, Carlos, let's start a bit about with your story before we dive down into the idea. So, you were working as a researcher, right? So, when did you actually thought that the research can become a product and you can build the company around it?
Yeah, first of all, thank you for the kind invitation. I hope I can share some of my experience with your audience. Basically, I've been studying cell biology and stem cells for many years. So I think it's probably more than 10, 15 years. And
Wow.
basically, when I made a kind of a development in some technical feature in the lab, I realized that that could be used for actually discovering or helping bring to market things that could actually work for things like hair loss, but also for wound regeneration.
Very interesting. And like once you started understanding that, then like how did you end up think envisioning the device and and building getting the idea to production.
Yeah, that's actually I need to tell you a small story so we can get to what nice
We love
is.
these, yes. So
That's yeah, that's good. That we can get to talk about what Niostem is today.
right.
So um so as a researcher on, let's say, basic science, biology, I actually started investigating. My interest was on cancer. And there are
Okay.
some types of cancer that actually originate. So they sprawl from stem cells. And therefore I started studying skin cancer. So
Okay.
by doing that, I had to develop some ways that I could do this research very quickly, because normally in the field I was, you would study this in mice as a
Right.
model for human cancer, right? And so by getting into a lot of slow processes of research, I started thinking, how can I make actual tools that can speed up this research so that eventually it doesn't take me 10 years
Right.
to get some interesting findings for new drugs against cancer and understand how cancer works in the skin, but actually bring it faster. So I developed a new technology, and there is a patent for that when I was at the Max Planck here in Germany, that
Right.
actually allowed for the first time that you would take this cancer in a petri dish and that you could kind of play with it and try to understand questions about their biology. So by doing that, I developed this technology that I actually had to use the normal hair stem cell. So this is the name of this particular cell type that actually grows hair. And then I started working with it. And fast forward, I discovered actually you can use such tool to discover new treatments for things like hair
Hmm.
loss and also skin regeneration. But then my initial thought was, okay, if I can discover new treatments, a treatment is normally a drug. So a small molecule, a chemical that you would take or
Right.
inject or put on your scalp. And that was my initial idea. But of course, the drug discovery path is super long and it's hundreds of millions of euros. Probably you're aware of that. So when I decided to leave my position as a postdoctoral researcher at the Max Planck after 5 years, I said, I'm convinced that this can help a lot of people. Let's try to do it. So I tried to go on the way of drug discovery, pharma. This
Right.
didn't work out. So then I thought maybe we can do it in a different way. And
Hmm.
then I was so convinced that I had to bring something to people that are suffering from either like wound healing problems or hair loss, that I decided to join this program called Entrepreneur First
Okay.
back in the days in Berlin. And then I met my initial co-founder. He was an electronic engineer. So when we talk about the question, I said, I have a tool that we can help people. Can we do this? And he said, but why do we have to use drugs? Maybe we can use devices. And that was interesting because part of my research was also understanding how, let's say, our organism responds to things that are not drugs. So pressure, for example, poking or stretching.
Right.
And then there we came up with the idea that maybe we could use something that is not a drug, but at the same time will kind of trigger this skin regeneration that we wanted. And that's how we came up with, okay, let's build a device and then this should replace drugs, but achieve the same goal, which is either increase wound healing, speed or efficiency, or grow hair. So that's a bit long story, but that's how we got actually to this idea of using a physical device instead of a chemical, a
Of
drug.
a chemical
Yeah.
drug. Right. Right. Wow. Yeah, that's a very solid background that you were actually doing research on this and then thinking of a chemical drug. But you're right, like any chemical drug would take tens of years, if not hundreds of years, right, to actually bring to production and make an impact. Whereas, yeah, this is a more non-invasive way of growing hair.
Actually, a drug like developing a drug from the stage where I was, that I had the tool to find new drugs to actually
Right.
bring it to market. It can take from 10 to 20 years. And
Correct.
the time is not the problem, because when I tell you how long it took us to go from the idea to actually have a device on the market, it's also, it's more than 5 years. But the problem is the cost of developing drugs.
Correct.
They are about 1 to 1.5 billion euros to develop
Wow.
one drug, because thousands of kind of initial candidates go in this pipeline. And then most of the times only big pharma can actually afford paying all the
Correct.
development and then going into the clinical trials and the regulatory approval. This takes years and years. So developing a drug is expensive and takes a lot of time.
Of course.
But we decided, okay, if big pharma are making drugs, maybe we can do something different that will have the same output, which is, okay, we want something to tackle to address hair loss, or we want something to
Right.
tackle to address wound healing. But this should not be necessarily a chemical compound. It could be a physical device that can actually modulate this regeneration in the body. And we
Right.
had the knowledge that actually these kind of cues, these mechanical cues, as I said, like poking, pulling from the lab I was, that actually this can control the regeneration. So we said, okay, we
Right.
just put this kind of new knowledge. I mean, it's new, but it was new already like in the 2000s. But bringing this kind of physical world into kind of a treatment world, this is what I wanted to
Right.
do when I set out with that.
Yeah, that's a very good vision. And what does the device actually do to regenerate hair?
Yeah, so what the device exactly does is that it transmits to the scalp. So only the upper layer of, only the upper layer of your head and on the scalp, it will apply small current. So electrical stimulation, we call it low level electrical stimulation. And this
Right.
creates activation of the, let's say, regeneration program. And by doing that, and this is non-invasive, right? So you don't need to pierce
Right.
your skin or anything. You just put it on. You make sure that it contacts the scalp, because, if you touch like this, you will have the hair in between. So you need to go through the
Correct.
hair. But once you do that, it stimulates the scalp in a way that we have also doing some research, and other people have done research. You can stimulate this growth pathway, so the
Okay.
growing mechanism of hair. And when you have lost hair because of the genetically inherited hair loss, which is called pattern baldness or androgenetic alopecia, and when
Right.
you have lost the hair, you can actually start reversing the process by doing this physical electrical stimulation of the scalp. And then we also have, of course, data showing that it actually works. We have already published trials in which we have tested this against a control group that was using a so-called placebo device. So it's a fake device. It looks exactly like the real one, but just doesn't stimulate with electricity. And we have this published this actually last week, and we have
Wow.
very good data showing that you don't need to take any sort of hormonal repressor or chemicals, but you can do it with a physical stimulation, like the
Wow.
Niostem
Right.
device.
Amazing. So you wear the Niostem device, and basically the electric pulses somehow program your hair follicles to start growing again.
Yeah. So basically, if
Amazing.
Yeah, not to go in this a lot of details, but when you have pattern baldness, what
Right.
happens is that if you imagine your follicles are kind of the plant pot that
Hmm.
hosts the plant. So in this case,
Right.
the
It's the
hair,
hair. The hair is the plant. Right.
they start shrinking over time. So imagine they are this thick. So
Hmm.
as you progress on this condition or also with
Right.
aging, these plant pods start getting smaller. So the
Okay.
hair gets smaller. And
Right.
eventually you will have this very thin hair that it seems you don't have hair, but actually you do have the hair. It's just very miniature.
Very thin.
And what we do is that with this electrical stimulation, we tell the body not to kind of start this shrinking process, but to
Hmm.
kind of this organ, because the hair follicles are
Right.
organ, to keep it active. So
Hmm.
sometimes I make a parallel with, for example, a muscle. So
Hmm.
to work
Correct.
out the muscle will grow over time. You know,
Right.
at some point you can make exercise to maintain the fitness and
Right.
the size as well. But definitely, if you were to stop exercising the muscle after a while, that you don't do any exercise, you don't trigger this
Hmm.
muscle, it will degenerate to the point that it reduces the mass, is weak. And this is what happens with the hair. So we kind of keep the hair in the gym, like we keep them
Right.
active. And by doing that, we prevent that it becomes miniaturized and therefore you
Hmm.
see the hair loss happening.
Very interesting analogy. I think, yeah, this is very innovative. Honestly, Carlos, I did not hear of this before looking at Niostem, and sounds superb. For you, like, was it like a culture shock when you moved from research into a startup life? Like, how does a scientist become a founder?
I mean, I don't think it was a shock because um, I was always interested on innovation, and
Right.
that was one of the reasons I came to the Max Planck, because they do really cutting edge science. So
Mm,
this is the kind of the age of innovation. And of course, one thing is to be in a laboratory doing really exciting research and discovering things, because nature is there. We just don't know it. So we discover
right.
things, but also a different kind of role in the world is the person or the people or the industry that takes this knowledge and brings it to the public, right? And I think,
To actually
well,
make the impact.
yeah, well, those things could be combined. And I think some governments tend to think that you can have both at once. I think they should exist independently. So
Mm,
one institution, like for example, here in Germany, is like the Max Planck Society, or also the universities that do great research. They should focus on basic research, right? Because that's what they do well. And when you do
correct.
basic research without the kind of profit in your mind, you are open-minded. So you can go and
Correct.
explore. But if you just do research, trying to look for, let's say, a new drug or a new development, then you narrow your path because you have a lot of money behind. So, like having both mixed, I think many people believe is good. I don't think it's really good. I think it's good to build bridges and people that can go from one side to the other to kind of try to look for synergies. So, when I
Right.
started the company, basically, I thought, okay, I created the company. I was with my co-founder, Sam. And the first thing I had to do was to come back to the lab, because
Mm,
actually we had a really good hypothesis that electrical stimulation could activate hair regeneration.
right.
There was no data, so I had to do my lab work, and
Correct.
I did what I did in the last 15 years to actually get some factual data that it works.
Mm,
And then it started more the discussions with, possible advisors, investors, people that could help us, because of course having a great idea is super important, but you need much more than an idea. You need to actually execute. You need money, and you need
correct.
people that help you. Then it was slow process in which I realized that, yeah, when it comes about science and talking about the how the hair regenerates and the stem cells, the technology, it was very easy for me to communicate with peers. But when I had to talk about my own research and what we're doing to business people, then it was a bit different, because they don't care about the details. They don't care about the
Mhm.
proof. They kind of care about, okay, I have very little time. Tell me why it's different and convince me, for which as a scientist, you are not trained to kind of convince people without data. So for
Mm,
scientists, you can have half an hour, panel discussion, or you can have a talk again before 10,000 people, but you're talking about your data and you know your data very well, and people care about your data. But I think in business, they don't care much about the science. They care more about how will you scale this? How will you raise money? Who else can participate? What is the
right.
And those things it wasn't a shock, but a slow learning process in which I realized that when I was trying to be very scientifically oriented,
People did not care. Like they were more interested in the business part of things.
Yeah, so they were more interested in something else that I could not tell in a short amount of time and in a seductive manner.
Right.
Because I was used to talking to scientists, and scientists care about details, but business people don't care about details. They care about
Correct.
bigger pictures and even bigger than the actual technology you are talking about. So, and I think learning how to talk to them while it's still, not being fake or disingenuine is very important. And this was what took me a lot of time, and still today it takes a little bit of time for me to kind of understand how best to talk to different people.
Switch
Get
your
out of them what I
scientist
need.
brain off and then put your founder hat on. That itself is always a context switch, because when you're
Yeah, this is tricky.
yeah, I'm sure. And I was looking at your website, amazing, like as you said, very data backed, and you're so confident of your product that you offer a money back guarantee. But it's an expensive product, right? And offering a money back guarantee is something which people usually avoid, right? Especially
Mhm.
and even a lot of nutraceutical companies who have all those claims, even they don't give such guarantees, because at the end it's biology, right? You might have done all your researches, but you never know. Maybe they're not putting it correctly, or maybe they're not using it in the best way. How does that, like, what gives you the confidence to say that, buy it, and if you're not able to get the results, then we'll pay the money back?
Yeah, I mean that decision we made it at the beginning when we launched the product. So we actually, so I founded the company 7 years ago. Before that, we worked maybe 3 years. The first 3 years we worked from kind of the idea, proof of concept, proof of principle. We raised money. And then only in 2023, we actually came to the market in Indiegogo, which is a product crowdfunding campaign. Maybe some people know it. And in that one, you kind of pay, and this money is used for the company, for us, to actually finish building the product in a way. We used that funding. So it was a really good success, great success. We raised 1.5 million euros for a technology that was not on the market for hair loss, for a product that didn't exist. So we invented even how it looks, how it works.
And it's difficult, right? Like hardware products are not easy. Like it's not like there's a whole supply chain. For every small change, you need to go back and then build everything from
this is the
scratch.
hard part. So basically, you're absolutely right. The hardware business has a lot of obstacles. It's expensive and slow, and that's why it took us so long to actually come to market. But once we were in the market, we actually tested the device, and we ran a small pilot, call it a clinical pilot, with 21 people, and that's also published in peer-reviewed journals already. And we knew from that small amount of people that all of them stopped their hair loss.
Wow.
And all of them, I think at the end, it was like 96% of them, they had signs of regrowth, which is what people want when they have hair loss. They want to stop it. And then they want to kind of start reversing it.
Correct.
So we base this decision on data. And we said, okay, of course, this 20 people is a very small sample, but we said, okay, we will make a bet that maybe it will work only in 80% of the people, unlike 100 in the pilot.
Right.
But even if 20% of the people will not see the results and they will ask for the money back guarantee, what we gain on basically trust building and credibility offering the guarantee is more than what we could potentially lose. So, and that was kind of the premise. Of course, then we did many things. For example, our devices are cloud connected devices, so you can see when people use them. Or if someone comes to me and say like, hey, Carlos, the device didn't work, I want my money back, I can go to the dashboard and say like, oh, sorry, but you didn't use the device. That's the reason it didn't work, because our data shows that if you use it at least 6 times a week, you will get the results in most of the cases, more than 90% of the cases. From that point of view, we de-risk by using technology. And then actually after we've been in the market for 3 years, our rate of money back is very low. It's lower than 1% of all the purchases that we have.
Wow.
And when people say, look, and they have the data, they show us the pictures, we can quantify the pictures. They don't have like other diseases or things like that. And then we just give the money back. And I think that has helped us more in the adoption of the technology, because it decreases the risk factor for our customers.
Yeah. Yeah, I think that's fair. Like if the person is actually using it, and that's the best part, that you have that data, you can understand whether it was used and it was used correctly or not.
Mhm.
And yeah, and what I was wondering is that it's a very high tech device, right? Like this is something which is it's not a it's not a phone or a watch which you can see and compare and all of that. And you're on a lot of online channels. You're on Amazon. You have your own website. All over, what channels have surprised you, and what channels have worked for you? What channels have not worked for you? Is it the website that does more, or is it Amazon that does more, or some other channel completely?
In general, I mean, we rely 95% of on our own e-commerce site.
Right,
We recently launched Amazon, especially in the .de, that is Germany,
right. The German
Austria,
Amazon.
Switzerland. But we're also available in European Amazon. But I must say that people like to buy more on our website.
Mm,
But I should also say that we have not invested as much money on the marketing on Amazon compared to our own website. Thing is that our product is a product that normally needs a bit of educational step before you can buy it. So
correct.
today, I should say yesterday, the price was
Okay.
990 euros for this one-time purchase of a hardware product that comes with, the app, and it's a combination of hardware and software.
Mm,
Today, actually today, to be very honest, we launched our subscription model. In the
okay.
subscription model, you only pay 89 euros a month, and then you have a minimal retention time of 6 months. Why 6 months? Because our clinical data shows that in 6 months you can see results. By 3 months,
Right.
there are results, but they are not all visible. So we change a little bit the business model at the
Mm,
moment. But technically, if you would buy just for 1,000, it's a big decision. At least in Germany, you compare
correct.
this to a new iPhone, to
Right.
Google
Yeah.
Pixel, I don't know, a
Correct.
new phone.
A new phone. Yeah. Same over here. I think. Yeah. Like
Yeah,
similar
but
price.
but when
Yeah.
people buy a phone, they know exactly what they get. I can
Mm,
call, I can surf, nice pictures, keen eye, you know exactly what you get. You just
correct.
want it the latest. But when you buy Niostem, you don't know what you get because the device looks a bit futuristic, I would say.
Mm.
Some people call it helmet. It doesn't really look like a helmet, but I understand where they come from. But then you say, okay, buy the helmet or this device, this wearable for 1,000. Will it
Mm,
work? I don't know. Will it work for me? I don't know. Of course, we have put a
correct.
lot of information out there to educate people. We have, as I said, 2 clinical trials that are already published in peer-reviewed journals, so they are scientifically proven and solid.
Right.
It's not like marketing materials, just scientific proof. We have run research with independent contract research organizations. So we want with the data to show that it really works. Still, 1,000 euros at once is difficult. And that's why we actually changed now to the subscription model to
Mm,
give more confidence people that, okay, I can pay monthly. And as people go and they see the effects, then they can just decide to keep paying. And
right.
it's not really a subscription as, for example, Shopify or iTunes, but we actually have a system in which if you pay the subscription, it's kind of a try before you buy. If you pay for 14
Mm,
months, then you will own the device forever.
got it.
So it's
Right.
just de-risking people's investment. And we believe this will help a lot of people making the decision of,
Mm,
because now it's not 1,000 euros today. If you can pay in installments, it makes it difficult for many. I will pay 89. And as I go, if I say, okay, this didn't work for me, because we know now that it doesn't work for everybody, it's normal.
mm.
Like any other, even like aspirin, doesn't work for everybody.
Exactly. Anything to do with with the human body.
Mhm.
Nothing can work for everyone.
Exactly. And if it doesn't work for you, you just send it back to us and
Hmm.
then just stop paying the subscription, and that's what.
Right, right. So it becomes very low. Like the entry to barrier then gets reduced really a
Yeah.
lot by
It's more than
almost
10 times
90%.
reduced.
Almost, yeah, exactly. Amazing. Yeah, that's a very smart strategy, I think. But are you scared of the devices being damaged when people send it back to you?
No, we have thoughts and concerns about many different things about the
Hmm.
subscription,
Right.
including fraud and mistreatment of the devices. Because at the end,
Right.
they belong to us. We just lease them.
Correct.
We allow people to use them, but we already have devices in the field for approximately 2 years, and I think the number of devices we get broken is less than like 2%.
Hmm.
We know the build is really good.
Is really good.
The electronics is really good. Everything, even the battery, like you charge the battery, and it lasts. You can use it without charging it again for at least 30 days or even 1 month and a half. And we see the battery also behaves very well. So we are very confident that the hardware from the factory comes at really good, like quality. Of course, it's different if I take a device and I drop it from the fifth floor, it will just smash. But we also have clear guidelines that it's like when you buy a laptop or a phone. If you buy a phone, even if it's new, if you drop it against the floor and you go back to the manufacturer and say like, your device was, is not working, they will say, sorry, but you broke it.
Right.
They technically have to pay for the repairman, or we can replace it, but they have to pay for it. So
Right.
we don't worry about many of these things at the moment. I think something I've learned on the founder journey is that you need to worry for things when they come.
Right.
Then find solutions.
And find solutions.
Before building systems in case something will happen. Of course, we're always saying, okay, big things like, okay, regulatory, legal, this product, we are all fine. But things like, okay, will people try to make fraud? Will people, I don't know, in the device? Because all these things, we just take it as they come. And I can give you a clear example of this is at the beginning, we thought we need to block one user to one device. So if you buy your device, you could not share it with your best friend, right? Because we want people to buy more devices. But then actually from the team, the concern came and said, like, why do we have to limit how people share something that they own, right? If I have a car, I want to give it to my friend, to my wife, to my boys, and they can take the car. So then we thought, okay, then we changed the way we approach things to say, let's see how people use the devices. And if we see one device is being used by 10 people, we can actually understand by talking to the customer of how is this, how they're using it. And maybe we can come up with maybe an offer or a system in which we can still profit from multiple users for one device, but we don't want to block them. So today, if you have, your best friend or even we have customers that use it with the wife because the wife also has hair loss.
Right.
So they just share it. They just have different accounts, but they use the same device. And there are so few people doing that we don't worry.
You don't worry about it.
We want happy customers, and they're happy by sharing, and we're happy they use the device. So.
Right. Yeah, I think, and this is very solid advice that, there are some things, some problems which can be delayed. Not every problem needs to be solved today.
Yeah.
You have a vision, that, okay, this might come up in the future. And then when it comes, then we look at it. We don't have to worry about everything today.
Exactly.
Prioritization is very important. I completely agree.
I agree with you.
And Carlos, everyone has been talking about AI these days, right? Like that's become like you open Instagram and you see 20 posts of how AI is changing the world. Does it also help to grow someone's hair, or do you think that is there some AI in your device?
The moment, I'm super interested in general about the topic. But from the product point of view, any change, like you were saying, of course, software is faster than hardware.
Right.
But now we're a little bit focused more on optimizing the product user experience. So not making so many hardcore changes on the system or on the actual hardware, how it looks, how it feels, how heavy, how it suits, because we know we have a very solid product. What we have been developing already for more than a year is smart system that can tell you how much hair you have.
Oh, wow.
Because
very interesting.
When you want to grow hair or stop your hair loss, the most important thing is that
data. Yes.
Right?
Correct.
And of course, we have hardcore customers that they go to a dermatologist and they make a tattoo and they, the hardcore thing. But reality is that 99% of our customers do not have this dedication or money to actually invest on making kind of a experiment on themselves. They just want to be told if it works or not. So we have two directions. One is we're developing sensors that can actually detect how much hair you have. And then this will automatically adjust the simulation. So to make it more efficient for yourself. This might or might not be done with AI, but it's just like an algorithm that actually personalizes. The second is, and for this we use machine learning algorithms, is that we have already thousands of pictures that people take of their hair, partly because it's needed for the guarantee. And we have trained now models with longitudinal data. So we have the same person like 1 month, 2 months, 3 months, 4 months, 6 months. Some people 1 year, so that we can actually develop an algorithm that detects what is the change of hair. And we are working now on deploying it on your phone that you can just move your over your head, and it compares automatically and actually tells you, okay, today you have this much or this much, and then helps people. So, and this is how are we using this? And of course, we use it for kind of running the back office. So things, automations, and better writing, better customer support, especially because, we have a German-based company. We don't have a single native speaker of German on the company. So we actually need this like simple AI tools to make really good translations, because people care a lot about the tone and how you answer things. And I think for these small things is great to have these AI tools and in any language you want. So we see that's two different things, but I would say our product is not heavily, and in the near future will not be heavily focused on AI, but we actually keep a good view of what's going on and trying to implement whatever we can to make the experience better, and also in the future develop these next generation devices that I think will be. Mhm. I think, I think it's journey in life as well. I heard this even from my grandma and my dad and my mom. I think the best piece of advice I can give for a founder is you need to work hard and you need to persevere if you want to achieve your goals. And I think even if you have a career outside being a founder, entrepreneurship, I think if you know what you want to achieve, and even if it's a dream, there is no way you can get there by, by just sitting and waiting or not working 120%. So you need to go do it, do things. And every time you fail, I think if you're convinced that that's what you want, you need to stand up and carry on, stand up and carry on. Because I can tell you as a founder, there are 99, let's say, bad things or down things that happen even every week, and maybe only one good one. But I think if you have this goal and you believe on it, and you can get people that actually believe that you guys, like the team, can do it together, it's a matter of time and hard work. So no reward without actual work. Probably this is the same when people say there is no free lunch. I mean, you cannot just get done without actually working for it. So working hard pays off, and sometimes you just learn, and learning is super important in life. God will get there. Don't worry. Thank you, Rachid, for your time. Happy to talk to you. Bye bye.